Hi, my name is Rob. I have my patient here with me. Can you tell me your name, please?
Brittany?
Okay, Brittany, we're gonna do a little examination with you today. Is that okay?
Yeah.
Okay. So the first thing I want to look at is her appearance. She's sitting calmly, pleasantly. Um, she's alert and oriented. Her skin color appears normal for her ethnicity. Okay, so the first thing we were gonna start at your head. Okay, I'm gonna palpate your scalp. Feel any tenderness?
No.
I don't feel any bumps or any. I don't notice any lesions in the skin that I can see. Okay. Um, the next thing we want to do is we want to inspect your face, and I'm looking for symmetry. Appears symmetrical. Everything's where it's supposed to be. Your facial features appear normal. Okay. So next thing we want to do is we want to check your cranial nerves 5 and 7. So I'm gonna have you raise your eyebrows. Can you smile? Can you frown? Okay, and can you raise your eyebrows against resistance? Yes. Okay, so all those findings are normal. I want to check facial sensation. Okay, so tell me if you can feel it's the same on both sides.
Yes.
Okay. Are you gonna tell me what's touching your face, if it's sharp or soft? Okay. Sharp or dull? Either way.
Sharp.
Okay.
Dull. Sharp. Dull.
Okay. Also, just want to palpate temporal muscles here. Any pain?
No.
And your masseter. Any pain?
No.
Tenderness? Can you open your jaw? Close? Okay. No crepitus, no popping or anything like that. We're gonna move on and we're gonna look at your eyes here. Okay. We're gonna look for red light reflex, corneal light reflex. Excuse me. The Hirschberg test. I can get this on. Okay, we're able to visualize the red light. Why do I keep saying red light? Corneal light reflex in both eyes. They're both equal. Normal findings. Okay, so next we're gonna do the cover and uncover test. So I'm gonna have you look at my nose, and I'm gonna cover one of your eyes. Okay. So we're checking for any extraocular movements. Left eye appears normal, no abnormalities. Same thing with the right eye. Okay. We're also gonna check your vision here, so I'm gonna go out of frame for a second. I'm gonna be 6 feet away, okay? Can you read the lowest line you can?
DHJBS.
Okay, and that was good. You were covering one of your eyes. Can you uncover the other eye? Cover the other eye and read the same line.
DHJBS.
Okay, so that's 20/20 vision. Also, when we were inspecting your eyes, we were making sure that they were symmetrical. I want to look at the sclera. The sclera appears white, shiny. Lacrimal duct appears normal. Any pressure or pain when I touch there? No. Let's look at the conjunctiva, pink. Conjunctiva looks normal as well. Okay, we're gonna check. I'm gonna shine a little light into your eyes. Okay. Okay, pupils are even, reactive to light. We're gonna check for accommodation, equal, round, reactive to light. You're gonna look at my pen light, okay? Okay, let's do that again. Okay, accommodation is okay. No abnormal findings there. This time you're gonna keep your head forward and you're gonna follow my pen light. We're gonna check the cardinal fields of vision, 6 cardinal fields, okay? Looking for any extraocular movements. That all appears normal there. Next thing we're gonna do is we're gonna check your peripheral vision, okay? So can you cover this left eye there? And you're gonna tell me when you can see my hand, okay?
No.
Okay. Same seat going?
Yeah.
Okay, we're gonna cover the other eye?
No.
Okay.
Let me see.
Okay. So peripheral vision is also intact. Okay. So I'm gonna take out my ophthalmoscope again, and we're gonna look in your eyes. Okay, we're gonna look for if we can see the retina, and we're gonna see the optic disc, if and see if we have any abnormal findings there. So I'm gonna look in your right eye here first. Oh, bear with me, technical difficulties here. Okay, I'm gonna get real close to you for a second. Okay, we can visualize the optic disc, looks intact. The retina don't appear to have any hemorrhaging or any abnormal findings. Let's look at the other side as well. Same thing, no abnormal findings. Retina appears intact. Optic disc appears normal as well. The next thing we want to do is move on to your ears, okay? So we're looking for symmetry. They look symmetrical. Size and no abnormal lesions. We're going to look behind the ears. No lesions. We're going to palpate the pinna. Any pain, tenderness, tragus. I'm going to push in on both sides. Any pain or tenderness?
No.
No. Okay. I'm going to look into your ear now, if that's okay. We can use our otoscope. Okay, we can visualize the tympanic membrane. Appears intact, pearly gray, no impaction, doesn't look like any hemorrhages, any blockage, or any lesions. We're going to do the same thing, look on the other side. Same thing, tympanic membrane looks pearly gray, it looks intact. Everything looks pretty good. The cone of light on the left was a 7, on the right side was a 5. I forgot to mention that, okay? We're gonna move on from your ears, and we're gonna, actually, we got one more test to do. So we're gonna do what's called the Weber test, a few more tests. You're gonna tell me if you hear this equally on both sides, or more stronger on one side, okay?
Yes, equal.
Equal? Okay. So we're going to do the Renee test. You're going to tell me when you don't hear the vibrations anymore, okay? And we,
Okay. Okay.
okay, so air conduction, which one was louder, by the way?
The second one.
Okay, that's a normal finding. It should be about twice as long air conduction as well. It should also be louder. So we're going to do the same thing on the other side.
Okay. Okay.
Okay. So that's a normal finding there, okay? We're gonna move on and we're gonna inspect your nose, okay? So looking at the bridge, I'm gonna palpate. Any pain, any tenderness?
No.
I'm gonna palpate your sinuses. Any pain or tenderness there?
No.
No, okay. The nose appears symmetrical. I don't notice any lesions, nothing abnormal noted. We're gonna take a look in your nose, so I'm gonna grab this scope again. I'm gonna take a look inside, okay? Okay, appears pink and moist. We're gonna look at the other side, no impactions. Pink and moist, the turbinates appear pink and moist as well and intact. We're also gonna check your sense of smell, so I'm gonna have you close your eyes. Okay, now close one nostril. What do you smell?
Garlic.
Okay, close that nostril. What do you smell?
Garlic.
Okay, sense of smell is intact. Cranial nerve 1. I'm also going to palpate your sinuses. I think I might have done this already, but
Mm-hmm.
do you feel any tenderness or pain?
No.
Or maxillary? No. Okay. Okay, so we're going to continue on. Your nose, everything appears normal. Let's continue on to your mouth and throat, okay? So we want to inspect for symmetry. Mouth appears symmetrically. You're going to open your mouth. I'm going to check. Okay. Buccal mucosa is pink, moist. Yes, actually that's good. Can you lift your tongue and can you put your tongue down? Can you stick your tongue out? Okay, normal. Can you? I want to. Okay. Thyroid. Not thyroid. Excuse me. What's the word I'm looking for here?
Tonsils.
Yeah, how'd you know? Yeah, your tonsils appear intact. No redness, no lesions. Your teeth were intact. You seem normal. I didn't notice any obvious like cavities or deformities or anything inside your mouth. Okay. The gums were red, not bleeding, or they weren't red, they weren't bleeding. The tongue you were able to move and had equal movement. Looked like strength was okay. Tonsils, everything. Okay. We want to check your gag reflex, so I'm going to use this tongue depressor. Please say ah. Okay, gag reflex is intact. We're gonna do something, and you're gonna tell me what you taste. Okay, it's gonna be a cotton swab. It's gonna have a taste on it. All right. Stick out your tongue. What do you taste?
Sour.
Okay. So let's do that again on the other side. What do you taste?
Sour.
Okay, that's right. Yes, sour was right. Okay. So next we want to move on to also no odors, nothing out of the normal, everything okay with the mouth, okay? We want to move on to the neck. I want to palpate your lymph nodes, okay? So I'm going to palpate first actually your ear preauricle, postauricle, okay? Just going to move down. No tenderness, no cervical, nothing, okay? Clavicle, nothing, okay? Submandible, submental, non-palpable, so that's a normal finding, okay? We're gonna palpate your carotid arteries. Okay, you can feel both, no thrill. Okay, that's a normal finding. I wanna also palpate your thyroid and I wanna listen, okay? So first for the thyroid, I'm gonna actually come behind you, and if you could just take a swallow. Okay, the thyroid appears symmetrical, no abnormal findings there. Okay, good. I'm gonna listen to your carotid arteries, and I'm also gonna listen to your thyroid. Okay, no bruit, no abnormal findings there. Okay, next I want you to turn your head towards me. Okay, now the other way. Good, and now can you lift your shoulders? Okay, that's normal findings of cranial nerve 7 and 9. We want to inspect your chest now, okay? So first I'm going to inspect the posterior chest. Okay, so if you don't mind, maybe we can go here, I'll lower the camera, and you can sit like with your back this way for me. I know this is not ideal, but we'll work with what we have here, okay? Is that good? All right. I'm gonna lift your shirt, is that okay? All right, first we're gonna inspect the skin. I don't see any lesions, any abnormalities. Okay, can you take a deep breath? Okay, chest expansion appears symmetrical, thoracic expansion. Let's do tactile fremitus. So we're gonna listen for vibrations. Can you say the word 99?
99, 99, 99, 99, 99.
Okay, no abnormal findings. I'm gonna listen to some lung sounds, if that's okay.
Mm-hmm.
Well, actually, let's do percussion too. Listen for any dull sounds. Sorry, there's a dog crying in the background. We're doing the best we can with this. Okay, I'm gonna listen to your lung sounds here, okay? So just take some deep breaths. Okay, lung sounds all clear, no wheezing, really all normal, clear, equal, bilateral. Okay, so we want to actually do something called the diaphragmatic excursion. So I need a pen here. I'm gonna have you take a deep breath and hold it, okay? Okay. And then breathe out and then hold it. Okay, so those are about 4 centimeters apart, which is a normal finding. Okay, so next I want to actually listen to lung sounds on the chest and in front, okay? So can you turn towards me? Okay. Can you breathe in? Okay, I'm just gonna look for any lesions or abnormalities or anything, okay? Everything appears normal. We're gonna listen to lung sounds again, okay? Chest expansion appears normal. Take some deep breaths for me. And normally we would do this. We would lift your shirt up, but for the sake of this video today, we're not going to do that. Okay. The next thing I want to do is check your heart. Okay, so we're going to listen to the sounds of your heart. Okay. So second intercostal space here on the right side. You're going to listen for the aorta. Here S1 and S2 on the right side. Pulmonic, sounds good. We're going to go down 1. Erb's point, S1 and S2 only, no gallop, no extra sounds. And then we're going to do the mitral. Okay, heart sounds, sound normal, no extra sounds, nothing like that. We're gonna inspect for JVD, okay? So I'm gonna have you lie down, if you don't mind, on your back. I'm gonna apply a little pressure to your abdomen here, and we're gonna inspect the neck for any jugular vein distension, okay? Okay, looks good. Other side looks good as well. Actually, don't move because I'm going to listen to some more arteries, okay? Okay. So I'm gonna listen, okay? First of all, I'm gonna feel for any thrills, aortic, renal, iliac, femoral. Okay, I don't feel any thrill. We're gonna listen for any bruit. No bruit, and then femoral. Again, normally, that would be skin to skin there, okay? We're also gonna feel for some pulses, okay? Radials, +2, brachials, +2, femoral, I felt earlier, but also +2, popliteal, +2, that's behind the knee, +2, post-tibial, sorry if I'm out of view here, hopefully I'm not, +2, pedal pulses, plus 2. Okay, so you can get up and sit up, and thank you so much for letting me do this. And that's my video. Okay, goodbye.